So I'm Becca and I'm one of the Sedge doctors. I was born in Yorkshire and then moved across to Tanzania for a couple of years growing up, and I think that's kind of gave me my passion for adventure. So I've been a doctor now coming on 3 years, trained in Wales, and I've been working in Inverness for the last couple of years as a doctor on the kind of highlands and islands, which has been great. From quite a young age I wanted to do medicine, so probably when I was 14 or 15. I just loved the idea of being a doctor and I quite liked the practical aspect. And it wasn't until uni that I then discovered that you could do sort of expedition and wilderness medicine. So I was involved in a lot of the societies at university that went and did medicine in remote and austere environments in Wales. Most of kind of expedition medicine is really preparing, getting to know who you've got on the trip, what medical conditions they have. Then I also think taking a bit of rest before going out, just to set your mind at ease and things. And then with the physical aspect, I guess being in Inverness, I'm kind of going up hills every other week. So from that side of things, I just kind of consistency with that. Pre-expedition stuff, planning, make sure all the kit's sorted, everything like that. As well, another kind of aspect is managing expectations, making sure everyone's comfortable with what they're doing. Most of what clients experience on trips, kind of blisters and things, they can deal with themselves, but the more severe and serious stuff, it's quite nice to have someone there who can give you a bit of support when you need it. One of the important things is making climbers aware of the symptoms before we go out. Sort of in a medical briefing, explain sort of what altitude sickness is, when they might expect to start getting symptoms, what the symptoms are. So sort of from a mild altitude sickness, things like headaches, nausea, loss of appetite, poor sleep, but then it's about monitoring them day to day, see if they're getting worse, see if they're getting better, and just kind of watching them whilst they're walking. Are they someone who's really far at the back? Are they struggling? Are they someone who's then at risk of developing things like HAPE and HACE? But I think one of the main things is making clients aware of what's normal when they get up to high altitude and what's not normal, and then it kind of relies on them to tell you how they're feeling so that I can treat them kind of best as possible, I guess. So I think one of the biggest things are blisters, because everyone always buys new boots the week before they go on a trip, and blisters can be the matter of are you going to finish or not. Again, with the kind of pre-expedition stuff, make sure people have got boots that they're comfortable with. And then other very common things like exhaustion, dehydration, and that can all be solved by making sure you're drinking a lot of fluids, electrolytes, eating enough, and then your just general cuts, grazes, falls, twist ankles, all kind of minor things but have the impact, quite a large impact on ruining someone's trip. So we're just going to have a quick look in the med bags that Sedge provide and just go through what medications we have, what equipment and things as well. So we've got our AMS medications. So most clients will bring their own Diamox and take it prophylactically, well, depending on the trip and the altitude profile and things. So we've got our acetazolamide Diamox, which is used for prevention and treatment of AMS. Also got nifedipine, again this is used for your treatment of HAPE. Our dexamethasone, which is for HACE as well. We've got antibiotics for travellers' diarrhoea, anti-sickness tablets, which is quite useful on the hills. You've got your allergy stuff, things like antibiotic eye ointment, antihistamines, ear drops for ear infections, and then another bulk of what would be used most days is your pain relief. So in this kit there's just your simple paracetamol, your ibuprofen, and then there's some stronger medications as well. Again, we encourage all clients to have their own medical kit, and they'll have all the things like blister plasters, paracetamol, ibuprofen, all the kind of standard stuff. So this is more of a reserve type thing. So this is all the sort of bandage stuff. So there's just some normal tape, or vet wrap or K-tape is usually pretty good. And then your wound management, so sterile dressings, steri strips as well. There's some burn dressings in here, some large dressings, and then some bandages for your kind of sprains, strains as well, and a lot of antiseptic wipes. Quickly show you about the emergency medications, which thankfully won't be used very much at all. So these are all the ampules. So ampules at high altitudes is high risk of freezing, and if they freeze they can kind of alter the chemical properties. That's why it's in this sort of insulated bag. You've got your adrenaline, again for sort of anaphylaxis or cardiac arrest scenarios, and your Stemetil as well, IV, IM. So these stuff that thankfully don't get used a lot, but it's always useful to have there. You've got all your gloves, got your monitoring stuff, and what's often neglected is sort of women's health. So tampons, sanitary towels. High altitude can play havoc with menstrual cycles and things, so it's always good to have extra, because clients often won't bring it if they're not expecting to be on their period. So that's good as well. Sharps bin, safety first. This is a bit of miscellaneous stuff. It's got a pregnancy test, kind of emergency dental repair kit, because often dental hygiene goes down on expeditions, so it's always good to have that along. Cutters, tweezers, Cat 1 tourniquet, antiseptic stuff. So we've got a lot of medications, but we need to administer them. So this has all your cannulas, needles, syringes, everything in it. Still got some COVID tests as well in here. It's got some lat flows, and then oral rehydration tablets, which are really useful for dehydration, and a giving set as well for a small bag of fluids. That's it, I think it's in here. I think the people make it really fun, both the clients and then the local people as well that you meet along the way. It's such sort of an intensive experience. You're with this group for sort of a week, 2 weeks at a time, and you kind of develop a bond which you just don't find anywhere else really. I would say just go for it. If you like the outdoors, if you like meeting new people and you want to do something amazing, then just buck it and go for it.